Hey everybody, Dennis Stanley here with Lindsay Jones University. And Lindsay Jones, I just got off a very interesting and I think somewhat exciting call with the National Board of Respiratory Care. Actually, it was a Zoom meeting and many of you were on that just the other day. And so I don't know, I think there was probably north of 100 people on that, and I think I saw some of you directors there. I was chatting with some of you, but what we want to do is cover what happened in that meeting, especially if you didn't get a chance to go. Now let me just mention that video, they say, is on your portal, on your NBRC portal. So if you want to go back and watch and get the gory details, you can. But what I want to do is take the next few video segments over the next few weeks and detail in a little bit more specific areas what they talked about in that meeting, how it impacts you, and what we as Lindsay Jones are also thinking about that. So we have two goals with these videos. One, of course, whether you're using Lindsay Jones University or not, just to provide more information to you as an instructor. I also am an instructor at a university, so I know how badly I want to know these things and prepare my students for the exam as well. And that's what it's really all about, is what's going to happen in 2027, what changes do you need to make in your curriculum or your syllabi in order to accommodate and prepare your students for the 2027 exam. So I'll talk about that. But I won't talk about it all in this video, of course, because there are lots and lots of things to talk about. So stay tuned. We'll probably release a video every week detailing part of this meeting and some of the impacts to you. But we'll cover things like what's not on the test, what is on the test, what the NBRC is saying about the new detailed content outline that I sometimes call the matrix. And we'll try to answer some of the questions you have, like how the NBRC is managing questions as it relates to clinical judgment. Remember, that's their new way of canceling clinical simulations, but bringing the essence of clinical simulations into a multiple choice question. I thought that part of the meeting was very, very interesting. And so the videos will talk about those and other things. There was also at the very end of the meeting some open-ended questions that could be asked. If you haven't watched that, that was very, very interesting. There was at least one or two instructors that I thought were fairly vocal about how they still felt like they need to get more out of this meeting, but they're still feeling a loss for what's happening on the 2027 test. And as you know, the NBRC is not always very forthcoming, and I'll talk about that in just a minute as well. So stay tuned and be sure you come to this page, subscribe to us on YouTube, however you do that. We'll also send out some emails here and there detailing the several parts and questions and focuses of that meeting, and we'll certainly talk about that and give you all the information we have, and also tell you what Lindsay Jones is doing to prepare for that. But let me first talk about that before I talk about some specifics that happened in that meeting. And what is Lindsay Jones doing? Right now, we have 800 clinical judgment questions written and ready to go. We're balancing them properly and validating them okay, and so we're working on that. We are planning at this point to be able to have the 2027 content ready for your students in 2026. Right now, our best guess is that we think we're going to be there in late summer, maybe early fall, maybe earlier than even late summer. We're going to see. This is all very fluid, and so as the NBRC rolls out information and understanding, we're just adapting to that. But we already have lots and lots of new questions written and patterned after the way the new exam is going to be. And then a big question that I'll always answer in these videos, because I get this question so many times, is that when is that material going to be available? And the answer is, as I just said, we hope to make it available in the latter part of the summer of 2026, because we know that you're already thinking that you have cohorts that are already going to graduate in 2027 and take that exam. What you must be wondering is, what do I need to do right now to prepare those group of students for that exam? We can appreciate that, and so we're going to work on that. But what that transition is going to look like, especially if you're a user of Lindsay Jones University, whether it's just your student using us as a personal home study or you as a school, is either you or the student or both are going to have the opportunity when you log in to make a decision to decide, do I want to study the 2026 material because I'm taking my test this year, or do I want to start looking at the 2027 material? So you'll get to choose that. And so stay tuned. We'll have some more details on that. We're ironing out some of those details on how that works exactly, but we'll try to make it seamless for you. Also, then if you're buying the 2026 material because you want to prepare your students, and then the new material comes out, for those of you schools that are working this way, If you have 2026 books, then all your class will automatically get replaced with a 2027 manual. So they'll technically have both manuals, and that'll come, of course, at no cost because we want to make sure we keep your students up to date. Now, what did they talk about at the NBRC meeting? Now, I can't talk about it all in this particular video, but I will definitely talk about these in the coming videos over the next few weeks. I thought the meeting was very, very interesting. It was led by Dr. Shaw, and of course, the president of the NBRC was also there and some other leaders. And I'm just going to tell you my take on it. But first of all, I want you to know I do not represent the NBRC. So I'm going to tell you my take on what happened at that meeting. And of course, it's important to me because we want the Lindsey Jones material to be accurate and be ready to help your students. But one of the thoughts that I had was that as we were listening to them, I was thinking that the NBRC they have a fear. And I think that fear is that they worry that you might be able to teach to the test. In fact, some person asked if they could use the secured assessment exam to learn what was on the exam. And Dr. Shaw kind of hesitated and he said, well, that's not what that's for. And yet they will be able to look at that exam and kind of get a feeling of what that exam is like. He did mention that there's going to be a free full-length exam produced and published in July, and that might be also a way that we could look at that free exam and kind of get a feel. But of course, it's not just one exam that's going to teach us everything that is supposed to be on that exam. So, but in keeping with the fact that they are really worried that we might tell somebody all the answers and you might teach to the exam, I think inferred in that idea is that they must feel that somebody has the capacity to learn things that help them answer questions on the exam, but are actually not prepared to be respiratory therapists. And they have the unenviable task to decide whether somebody is safe enough to take care of a patient. If you think about it, their main job is to protect the healthcare consumer from a respiratory therapist that's not really prepared to be a respiratory therapist. So we respect that task that they have. But at the same time, I've always felt this, I think you probably feel this too. I have gone in and taught 3-4-day seminars to people that are preparing for the exam, and I just want to say it is impossible to teach to the exam. If I come in to a school or a university and they do not have a good education, if you've not already taught them, if they've not already learned all that they're supposed to learn academically and clinically, I could talk till I was blue in the face and it's not going to help them pass the exam. So I don't think that's their biggest fear. But the NBRC, I think, lives with that fear that you might teach to the exam and that somehow that therapist might pass the test but not really be prepared to be a therapist. I don't think it's a legitimate worry, but they protect their exam in that way. So with that fear in mind, that means that they're not very disclosing or transparent about what's happening on the exam. Let me just give you an example of something that happened in that meeting. One of the things that happened is that there were some questions asked, of course, about what's not on the exam, what is on the exam. And they said something very, very interesting. They said, you just need to look at the matrix or the detailed content outline. Well, I was chatting with another instructor afterwards, and all of you are going to appreciate this. I was like, yeah, just because they have a detail on that content outline and they say they're going to cover hyperinflation therapy and IE or EG, this and this and this, it doesn't mean that they're giving you enough detail. In other words, just on that one line on the matrix, there might be, 10 chapters in a book that cover that. And then you're still left to wonder, yes, but what in all of that do I need to prepare my students? And that's what the NBRC is not going to tell you. So I think they think it's enough that they say, in fact, that you should study everything on that outline, but they're not taking into account that everything on that outline would be teachable if you had 4 or 5 years with the students, but you don't. You don't have that kind of time. In fact, I was talking to a director of a respiratory program, and that's what he said. He said, we don't have the kind of time to guess and teach every possible thing that matrix content area could cover, and so that leaves you with speculating. So we know that's frustrating. What we do at Lindsey Jones is we speculate. We pay very, very close attention to the NBRC, and we try to decide what that could be. Now, we've been doing this for 30 years, so we're pretty good. We know that's true because when we help people pass the test, we're able to get a very, very high percentage of them passed. But it's not like the NBRC is calling Dennis Stanley up and saying, hey, Dennis, we had a change on the test, and here's a question that is now going to be on the test. They don't do that. And I don't share questions that are on the exam. I don't even let other people share questions with me that are on the exam. I stop them cold if they're going to do that. But that's okay, because we think that it doesn't matter even if somebody told them an exact question on the exam. It's really not the ability for the student to memorize information. They have to understand it, and that's our goal as well at Lindsey Jones, is to teach the information so that they understand it, so that we give them practice questions, and in that context they really feel the cognitive level of the question and they figure out, I know what to do. They become confident. So that's what's happening at that meeting. All right, now that we kind of understand the psyche and the mindset of the NBRC, I want to talk about one of the topics that they talked about. I'm going to talk about it in some level of detail right now, but I'll go into more detail later in subsequent videos. So just keep following us and keep track of us. We'll tell you things as we understand them. But the main question is, first question is, what's not on the exam? I thought that was a very, very interesting conversation. Now, the classic question was asked, is IPPB on the exam? So I'm going to use that as an example. And whenever questions were asked like that, let me tell you what my impression of their response was. Their response basically was that they recognize that some therapies, modalities, equipment, but specifically therapies, they come in and out of vogue. So sometimes they're very, very important, and then sometimes they fall back and are not used very much anymore. They mentioned a few of those therapies. So for instance, things like transtracheal oxygen administration, or in this case IPPB, they recognize that that's not used anymore, and so they just suggested as a guideline that you understand what therapies aren't really used anymore and their likelihood of dropping that. But they would not totally always specifically answer, is this on the exam? They would not answer that necessarily very, very directly. With a few things they kind of did, but they also caveated, and this is super important. So Dr. Shaw said, for instance, with transtracheal oxygen catheters, he's saying, yeah, that means they're probably not going to present a question where that's the answer, or ask questions about the breadth of knowledge in terms of some of the details about setting that up, or even some of the complications there. But it doesn't mean, he mentioned, that it isn't showing up in the narrative or the story or the history of that patient. I think that's very, very important, because that means you could have a description of a patient who's been using a transtracheal oxygen catheter for 6 months. And then the question is not necessarily about that, but the question is about something else. Here's why I think that's important, because even though that is a faded therapy, and you might think I don't have to teach that anymore, our thoughts are, what happens to a student when they get on the exam and they see that the patient is on a transtracheal oxygen catheter? In the narrative, they don't automatically know to exclude that as something that they don't have to worry about. And so my advice is, even those therapies such as IPPB, though we don't have to spend pages talking about what it is or how to use it, we do need to tell our therapists, our students, enough about that so that when they see those things, they still have a general understanding of what that is. So take a look at IPB, for instance. IPPB as a machine, and that very specific approach may not be tested on. They may not even mention that in the question. They could, according to Dr. Shaw, somebody could still say IPPB in a question, but the question isn't necessarily about the IPB therapy. And yet at the same time, if you back off and say, well, what is that therapy? Well, that's hyperinflation therapy. And do they test hyperinflation therapy on the exam? Absolutely yes. But you'll want to pay a little bit more attention to the current devices and therapy approaches that they use. So take that for what it's worth. There are some things that are no longer asked on the exam, no doubt, and yet they still could be in the narrative of a question. They did get specific with a few other things. They were not exhaustive with what's not in the exam, but for instance, they talk about peak flow meters. They mentioned that asking questions about the peak flow meter, possibly even the device or setting it up or referring to it, probably not on there, but they didn't say, in fact, they said that that doesn't mean that the student doesn't have to interpret the results of peak flow monitoring. So that's very interesting to us as well. That means you're still teaching peak flows. just that they may not get asked a question about the device in terms of the breadth of knowledge on the exam, but they still may have to interpret the flows and decide what to do for the patient, particularly as it relates to asthma. Hemodynamics is another good example of that. Hemodynamics, they mention that they're not necessarily interested in knowing that you know how to set it up and some of the equipment and maybe the insertion policies or approaches for that. And yet at the same time, the student could see hemodynamic values and they would need to know how to interpret that and certainly how to react to the patient. Dr. Shaw also just mentioned, in his own words, he mentioned something to the fact that what if you're transferring somebody with a hemodynamic monitoring in place and during the transfer something changed, the student still has to know enough about what to do with that equipment to correct the problem. So for instance, maybe the catheter's come loose and it's come out and it's been withdrawn a little bit. The student may need to recognize on the waveform that the catheter may need to be inserted or advanced a little bit more. And so here you are back to the same boat where the NBRC, by virtue of the detailed content area outline, is saying hemodynamics aren't on the test anymore, but at the same time you might be thinking, well, but they still could ask questions about hemodynamics, and that's true. So you're still back to teaching hemodynamics, but probably not specific questions about how the catheter works or how it's inserted, that kind of thing. And so although there are things that are off of the examination, you still probably need to teach them to a degree so that students recognize what they are. You know, when a student gets on an exam and they see something that they don't ever recognize, no one has said anything about that, then, as you might imagine, the anxiety goes up and they worry that that's something that they're supposed to know. They might even hyper-focus on that thing, that piece of equipment or that therapy that they never heard of and think that's the answer. That's always tempting for students to do that. So I would teach just enough to be careful about that. So there are a number of things that are not on the exam anymore. One other interesting question that I'll just share with you, and then I'll ask you to stay tuned for our future videos where I'll go into more detail about all of these things that we've talked about and some more things that occurred in that meeting. But one of the things that when somebody asks what's not on the exam, a leader in the NBRC turned that person back to the detailed content outline. But Dr. Shaw kind of corrected them just a little bit and say, wait a minute, he wanted to point out that the detailed content outline does not in any way tell you what's no longer on the exam. It just tells you what is on the exam. So he says, I wouldn't want to mislead anybody. And so then he said that the only place you could find, or this discussion is in the current meeting that we were in, and maybe to some degree what was talked about in the Jimmy Young Memorial lecture that occurred in the summer forum of the AARC conference. So anyway, that's just a little bit of a teaser of what's happening and what happened in that meeting, what's going to happen in the 2027 material changes for the exam. There are lots more exciting things I'm going to share with you so that you know and our take and what Lindsay Jones is doing about that, but I'll share that in some subsequent videos. So stay tuned and keep track of us. We'll see you next time.